Hello again, Ari. Back for the cardio physical assessment here now. So again, we washed our hands. I've explained to Chris what we're gonna do. We're gonna do a cardio assessment. We have his gown removed and he is okay with doing this assessment and knows that I'm going to be touching him and listening to his heart. Alright, so first we would do inspection similar to what we just did. We're looking at everything. We don't see any abnormal protrusions or anything that's not symmetrical. His temperature seems fine. He's not clammy. He's not sweaty. He's not having any trouble breathing or anything obvious like that. We would check his hands again. Capillary refills on both hands look good. His hands aren't clammy or sweaty or anything. Capillary refill, good on those as well. Hands are warm. Everything seems fine there. Hair distribution again is normal. There's no rubbing or anything. His chest is fine. It's not barreled or protruded or anything. Like I said again, temperature and texture of skin is fine. If I was to do blood pressure on him, we would do it in all positions, sitting, standing, and lying down, just for a full cardio assessment. We would make sure that he has rested for at least 5 to 10 minutes beforehand, no smoking, no coffee, or no exercise beforehand. And we would preferably do both sides again, just to get the right arm and the left arm to get a full accurate assessment. And alright, so now we're just going to palpate the two, the carotid pulse and the radial pulse. So carotid pulse on a male is nice and easy. You just find the Adam's apple and then you move right to left. So I can find it there pretty good. You make sure you use your 2 fingers and not your thumb, because you have a pulse in your thumb as well. And I can feel it there. And of course I would just feel this, and I could either do it for 30 seconds and double that to get the pulse rate, or I could listen to it for 10 and multiply by 6, or I could listen to it for a full minute. And you would do that on both sides, and then for your radial, you just find the thumb, follow it down again with your 2 fingers, and I can feel it very strong there right now. And then to count it, same thing, just get your total for a minute and do both arms. And I can find it there. Alright, and now we would inspect the neck. So again, there's no protrusions, nothing any obvious. I can just see his regular muscles there, but I don't see any pulses or anything protruding at all. Everything looks symmetrical and fine. Sit up straight, please. And then we can listen to his carotid pulse just to see if there's any bruit. So we'll do that just on one side. And you would use the diaphragm . No, don't have to breathe in. Okay, and I don't hear anything. And then if I wanted to use the bell, and no bruit sounds there either. Okay. Then for the precordium, we just want to again see any pulsations, so you can just feel for his heartbeat through his chest wall. He's sitting up straight. No thrills, no heaves. If I wanted to find the apical pulse, that's at the 5th intercostal space. So again, I would go to the notch, go down to the angle of Louis, over you find your second intercostal space. And then I can go down 2, 3, 4, and 5 would be right under here. I can feel that there. And if I wanted to take that pulse, again, same idea as the carotid and the radial, I just would count that for 60 seconds to get that. Alright, so using the diaphragm, we're going to listen to the heart sounds again. So we got 5 heart sounds that we're mainly concerned about. And there's a mnemonic for that. So all patients effectively take medication. So that's for aortic, pulmonary, Erb's point, which is just the middle, tricuspid valve, and mitral valve. So these two here, the aortic and pulmonary, they represent our S2 sounds. So again, I would find the angle of Louis that comes over to the second intercostal space, and the second or third is where I would be able to feel this. So the S2, like I said, that's going to be the most prominent, so that's the dub of the love dub. And I can hear that strong there. And then go over and listen for the pulmonary. And it's very strong. And I can listen to the Erb's point, which is just middle. And then the tricuspid, this is the S1 sound, so the lub is going to be more prominent. And the mitral. And the lub is more prominent there. And these two here, where the S1 sounds are more prominent, that's going to coincide with the carotid pulse as well. And then I would be able to use the bell to assess the same 5 areas. The bell is more so used to be able to detect any murmurs or any S3 or S4 sounds. So I'd be able to just switch that over. And just be able to listen. And I don't hear anything there. And then lastly, it just says to make a note of why you would get the patient to lean forward or on their left side for this exam. So if the patient was to lean forward slightly, that pushes the heart just towards the rib cage a little bit better, and you can get a more anatomical sound from that and a more anatomical pulse. Putting them on their left side will just again shift the heart closer to the wall, the chest wall, and give you a better assessment rating of that as well. And you wouldn't have to do anything on the back so much for the cardiac assessment because it is towards the front that you're going to feel everything. The scapula would block most of the back. And that is everything. Thank you. Thank you, Chris.
Thank you.